Talking about back pain, I mean, there's different types of pain and there's also the way that the pain manifests. How do you broadly categorize these as a physiatrist?
So one of the ways we look at is two major categories. One would be more trauma-related and the other would be non-traumatic back pain. I give the example of someone's at home and they moving a couch and they picked it up and they feel their back out. So that is an event that caused some type of trauma. Another one is you just woke up in the morning and you have back pain. You didn't do anything, you can't correlate it to a specific incident. That are two broad categories that we usually separate back pain into. And it helps us to determine what might be the cause, whether it's something that ruptured something or something that's a more insidious or slowly progressing problem that builds up over time.
So, and when we're looking at these two categories, traumatic, where it's related to a specific incident, and non-traumatic, where it might be the consequence of something, this pressure or something building up over time, are there further ways that the back pain is distinguished?
So we also look at the timing of the pain, whether it was acute or it's chronic. So some things build up over time, right? So I felt a little bit of back pain, progressively worsened over the past year to the point where it became severe, is different than, one day I woke up and boom, I have severe back pain. That's another way we can kind of categorize them or delve deeper into what caused it. So if I said to you, you know what, one day you bent over and tie your shoes and all of a sudden, boom, you have severe back pain. Versus, you know what, doc, every morning my back was achy and stiff, and over the past year, now I get up in the morning, my back pain is severe. That's two different types of categories of pain, which leads us into different directions to figure out what's going on.
And in terms of back pain, it could be like a bone cause, or it could be something related to muscle or ligament.
Yes.
Or it could be, I guess these all involve nerves. I mean, if you're feeling pain, it's involving nerves, but there could also be a cause that is specifically nerve related. Is that a rough way to?
Yeah, we talk about the pain generators. So where is the pain coming from, right? There's different structures in the back that can cause pain. All of them related to nerves, different types of nerves and where those nerves are located. The classic one is disc pain or discogenic pain, right? So we talk about disc herniations, slip disc, ruptured discs. So the disc itself is innervated with a whole bunch of nerves. So when you have a disc injury, that can cause a lot of pain. Another very common cause of back pain is what we call facet joint pain. So that's typically caused by arthritis. So over time, your back starts to get arthritic, whether you're aging or whether you've done a lot of repetitive type of movements, you start to wear down the little cartilage in the joints in your spine. And over time, they wear down so much, they become arthritic. And it's almost like they're bone on bone, and they get inflamed and swollen, and it's painful. So you're right, there's different categories of pain based on what you injured and which one of those structures is causing the pain, whether that's bone, disc, cartilage, or from the joints in the spine.
And when you're talking about this tissue wearing down between the
joints,
is that the same as the discs in the?
Nope. So there's something we call degenerative disc disease. So your discs are made of cartilage, right? And those can wear down over time. Some people's wear down faster than others. There's also cartilage in between the little joints in the spine. We call that the facet joints. Those joints are actually in the back of the spine, and when you use movement or have movement in the spine, some of it is coming from the disc, some of it is coming from the joint. So you have different types of pain depending on did the disc wear down versus the cartilage in the little joints wear down.
What is the most common cause that you're seeing in your practice?
In the younger population, it's usually a disc injury.
In the younger population?
Younger population.
So doing some kind of sport or something like that?
Correct. Or your type of job where you're very manual. You're in construction and you're doing a repetitive amount of lifting. There's a repetitive component to the discs wearing down. Older population, in general, usually it's an arthritic condition. The spine actually becomes arthritic, just like a knee joint can become arthritic, or a hip joint can get osteoarthritis. You can get arthritis in your spine. So the little joints in the back, they wear down over time. and they can become arthritic, and that is painful. So those two probably the most common we see depending on age group and activity.
When you talk about the younger people in workplace, I think it's probably maybe 20 or 30 years back, there was this real push, like probably related to the amount that it was costing governments or costing countries in compensation, and there was this real push to educate people in manual jobs on how to lift properly.
Correct. Has
that worked? Has there seen a reduction in back injuries since then?
So when it's followed, it does reduce back injuries, especially in people who have manual type of labor. But the problem is compliance with that is usually very low. So unless you're continually reinforcing that in the workplace, it's not usually followed, and it doesn't have a big impact. But those concepts, when followed, can be very helpful. When we talk about stress and strain on the spine, usually when you're picking something up, the closer that object or weight is to your body, the less force it's putting on your spine. The further away it is from your body, the more force it's putting on your spine. So when you're talking about lifting, we're talking about bending at your knees, and we're talking about keeping that object close to you. Instead of bending at the waist and putting that object, very far away from you, your risk of injury from an acute traumatic injury goes way up. The more you're using your back and the more you're putting that object way out, okay? Same concept with women who have a child. Right? Women who have children, it's better to carry the baby closer to your body. Worse if you're always putting the baby further away from your body. Better if you're picking up the child off the floor with your knees instead of bending over at the waist to pick them up. So these concepts hold true whether you're at work or whether you're at home. Yes, it can have a big impact as long as people follow those principles.
We've talked about some of the different potential causes of back pain. Dr. Noto, you mentioned that if in old age it's more likely to be something like arthritis, where you're getting these bones, like the cushioning between the bones is wearing down, and in younger people it's more likely to be a specific incident that's triggered it. In either case, when is it time to see a doctor? What are the signs in this pain that someone should take notice of that there's something serious going on?
So when we talk about the more traumatic ones, so like you lifted something and you hurt your back, usually we go 48 hours with rest, ice, sometimes if the pain is severe, like an anti-inflammatory, like an Advil. But after 48 hours, that pain didn't go away and it's still pretty severe, that's a sign you better get it checked out because you might have really injured something. The other thing we look at is when back pain is combined with other symptoms. So if it's just your back that bothers you, we get less concerned. But if it's your back is bad, but now you start to feel tingling or numbness in your legs, okay? Now you start to feel weakness in your legs and feet. That's concerning. That should be worked up and you should see a physician. So a very common thing is called sciatica. And usually that's defined as people who have back pain that starts to travel into the leg or shoots down the leg, as we say. Sciatica in itself is not necessarily dangerous, but if you have sciatica and you combine that with weakness or numbness or weird feelings in the legs, it becomes more concerning that you're injuring one of the nerves in your back. So a disc problem is usually a disc ruptures, and if it ruptures and it's big enough, it can actually put pressure or sit on one of the major nerves in the back. One of those nerves is the sciatic nerve. So once it puts a lot of pressure on it, you start to feel pain in your legs. You start to feel numbness or weakness in your legs. That becomes more concerning because we worry about nerve damage. The last thing we want to see is someone who has back pain and then they come in and they say, you know what, my foot's kind of weak. You know, I walk and my foot kind of like flops. Okay, that's not good because your back pain might go away, but you might be left with a weak foot. And now you're walking around for the rest of your life with a foot that's kind of floppy. Obviously, that's not great. So if you have a back pain and you start to notice weakness in your legs, it's a sure sign you better get to the doctor.